they're coming next week, next Monday?
Yes, ma'am. I did notice that I got a letter, like, I guess, Sunday. This past week, they were coming Monday. Even though they called me Monday morning that they couldn't, arrive. But I have not gotten anything in the mail at all since about their rescheduling. However, they did verbally, they tell me that it was gonna be, let me just make sure, rescheduled to Monday, the 22nd at 11 a.m. to 1 p.m. for long-term personal care service. And it did say in that letter from this past Sunday that the one on this past Monday, I did meet their criteria for all they needed was to come in to do the assessment, and they would then it said something about that, I guess, about what, I don't know exactly what it meant by the assessment, but
yeah, they just kind of come in and assess what type of needs you possibly would need. I don't know if you would need help around the house. Sometimes they'll give services for basically anything. They'll clean for, depending on what type of help you need. If you need some type of financial services, that's why they go over a full, thorough examination from all of your social determinants of health, like your home life, finances. So, yeah.
What do they typically do for finances?
Well, you already, it's kind of like they help with budgeting. It's not like they give you extra money or anything like that. Do you get Social Security or disability?
Yes, ma'am.
What do you get?
So it's just SSI.
SSI?
Just DI, so only the 967.
Okay.
I do a pretty good job budgeting myself,
okay.
But I don't know. I would still be interested in whatever they have for that, I guess. I don't know exactly what they do.
Rent?
Yes, ma'am. My family owns the condo, and I pay rent for it. Yeah.
Oh, so you do pay. How much do you pay?
$250.
Okay.
And most of the other goes to debt and stuff.
Okay.
And I pay for food and all of that, and I have a lot of debt because of my parents and things. So.
Do you have any other income besides that $967?
Some investments,
okay.
Yeah, but not that much. It doesn't amount to a lot at all. It's like, it shouldn't be really considered just in case.
Okay. Do you have a transportation?
No, ma'am. I only have Medicaid transportation for appointments.
But you use the Meditrans?
Yeah, okay. But I don't have any direct transportation to the pharmacy. I don't have direct transportation to stores. I don't have anything like that.
So they can help with that too. Alright. Can you tell me a little bit about your medical history? Like what currently, any type of diagnosis that you have and some past diagnosis and hospitalization?
Narcolepsy without cataplexy.
Have you had that? Since birth?
Since interferon for my stage 4 malignant melanoma, which is still current.
Okay.
So June of 2008, I guess. That's related to brain damage and from the treatment, and that's with that is epilepsy.
What kind of treatment did you have?
Intron alpha 2. Alpha 2B, thanks.
And what year were you diagnosed with the malignant melanoma?
2008.
Okay.
And it's stage 4 terminal.
Okay.
So I still have it. Yeah, it's just under control for now, but it's not. They don't really have remission for melanoma.
Gotcha.
It's just not that type of cancer.
Who is your oncologist?
Dr. Bowman, but give me a second, I can give you the contact information.
Okay.
Dr. Brian Christopher Bowman at
How do you spell his last name?
Boulmay at University Medical Center. He's their chief of infusions for oncology. He's with the Stanley F. Scott Cancer Center in the VA.
Okay. Do you have a number with him?
Oh, yes, ma'am. Just let me make sure that I give you the right one. Do you hear that?
Yeah, it's like a drip or something.
Where's that coming from?
Oh, it sounds like must be when your air conditioner turned off. Because it was just on.
It's just water or something. His email is bboulm@lsuhsc.edu. And the address is University Medical Center Cancer Center. 2000 Canal Street, New Orleans. 504-702-331 is the
504-702
702-331 but that's the patient one.
Okay.
So that's probably not going to work. But he has a different address that's more direct. It's probably better for you to contact. That's room 526, 533, Bolivar Street, New Orleans, Louisiana 70112. So you guys can probably mail them or something there.
Okay.
And if you need me to sign a release for medical records or something, I can.
Okay.
I don't mind. It's up to you.
Alright. Do you have a primary care doctor?
Yes, ma'am. Dr. Tran. And
where is he out of? Is he with
she's with Access Health.
Access Health.
And I keep forgetting to make a contact for them.
Okay.
But it's I actually just received my new Aetna card.
Okay.
In the mail. Which I think is upstairs somewhere, but I can I'm gonna log into my Access Health page and I'll just tell you the page. And or at least her listed thing. I switched my VPN to somewhere else. Sorry, one second. before I go for that. I'm gonna try to change it to the desktop site. Still the mobile site. Appointments. You can probably click that. I do have an appointment with her next week.
Next week?
Yes, I do. Because my dermatologist wanted me to make an appointment with her.
Your dermatologist?
Yes, ma'am. And I see my dermatologist next week too. See Dr. Tran or Nurse Practitioner Tran next week on the 24th, and I see my dermatologist on the 26th.
They say neuro.
Or dermatologist.
Oh, derm.
Sorry, ma'am.
Okay.
Yes, it's a TRAN space PHAM Nurse Practitioner. 501 Robert Boulevard, 985-607-0400.
And then your dermatologist is?
My dermatologist is, my calendar thing, I have it on there. I'm having a lot of new doctors when I'm on my contacts really yet. Let me see. No, there we go. Is, Andrea Ortling, nurse practitioner. It's Andrea, Oertling. And that is Dimitri Dermatology, Suite 201, 600 North Highway 190, Covington, Louisiana, 70433, 985-643-4575. And then I see another doctor at Access Health for endocrinology, and I got referred to him for nurse practitioner training, and that's Dr. Patrick Johnson, out in Belchase. He's at 8200 Highway 23, 504-398-1100. He's a general practitioner.
And what are you seeing him for?
Endocrinology.
I know, but what kind of endocrinology issues are you having?
Transgender stuff.
Okay. Are you transitioning?
Yes.
Okay.
And just I'm on the hormones and the things like I was in like high school and stuff again, and I'm already doing better for sure, gaining weight, which is nice. I just have always needed to be on hormones. I did the whole growth hormone, right? Human growth hormone replacement therapy. I couldn't grow. I didn't have proper hormone development when I was born. So it was just me being with endocrinology has always been something that has happened across my life. Gotcha. So this was always something that was going to happen, basically. Gotcha. It just was kind of like on a wait and see to an extent, and I was supposed to kind of do this when I was in college, and I started to, but then issues happened with my family and things, and it didn't really happen. But now I have my own insurance and stuff, so I was able to get on the it was good that things were starting to work out. And the medicine's definitely working. There's been a very big improvement across the board, for sure. It's been which was my experience in high school as well. That having I just have to be on hormone supplementation for the rest of my life. There's just no way around it. I don't make appropriate amounts of anything, and like, I was very surprised to hear from Dr. Johnson, said that my lab results had showed that I finally got to a baseline for testosterone for the first time in my life on my own. So they lowered that, and that probably helped with medication. But before that, I had never actually really produced enough to have any in my body. Like, it was just not there almost. And that was always kind of a concern. I just was born that way. So that's why the estriol was working very well, because I just don't naturally really have any testosterone. So it's probably just a very, very, very small amount of production, and it just takes a very, very long time, probably like a decade, to have gotten to where I was very shocked that I actually was at a baseline, because I had those full tests and stuff when I was younger, and how it was expressed to me is because of the damage from even my cancer treatment and stuff to my brain, plus the inability to do certain things beforehand, that I wouldn't have that ability for it, like, in any point in my life. But it must have just been like accruing or something. And I did start to do a lot worse, like, as over the past, you could see I didn't look good over the past year or two. It just,
and now you're improving with the
but like marketably, like, you can see my appearance, it looks much better. I look a lot healthier, etc. Yeah, which is where I was in high school. I gained weight. I kind of filled out. The muscle structure looked better, like, on my face and stuff like that. Like, starting to kind of do. The hair is like not falling out kind of anymore. I don't really. Even my mother was saying significantly when she'd sometimes see me, like, in January and stuff, like this year, like, that my hair had looked like it was falling out, and there was like humps of hair and stuff, like, on the ground and things like that, and those were like indications of things, like with my cancer and stuff like that. And I started to, it just wasn't good, I guess. But now it's much different. And I've only been on the medication for like a month and a half on the, I guess, a lower dosage. So it's been a very big improvement.
Okay, very good. That's good. And do you have like family support?
No.
None?
No, I don't have a good relationship, I guess, with my parents.
Okay.
My mother doesn't really handle the transitioning stuff very well. I think her biggest concerns are surgery and stuff, but my doctors have told me that surgery isn't really like a thing in the near future. Is going to be something that they're going to consider in 2 years. They told me that 2 years is going to be a minimum. Because it does seem like surgery is not necessarily the go-to a lot of times anymore, especially if the patient reacts very well to the hormones, and they have like a circumstance like myself, like with it being something they were born with in certain way, in that kind of patient, and that seems like that's the norm. So I might not be pursuing that. It depends on what my physicians tell me. But I don't. That's not helping my relationship with them very much. So I'd say my relationship with them is very bad. Most of the time they've been very abusive in the past, but they also have other problems, I guess. But it's not really an excuse. It's just they haven't been very acceptable and stuff. Like, law enforcement has been involved very heavily to certain things. But they moved me here so that and bought me this place so that that would alleviate a lot of stuff, because my father was diagnosed with Alzheimer's dementia.
Mhm.
So that was just something that was going to have to happen. That would have to happen would be better for him.
Yeah.
Like, there wasn't anything I did with
Right.
him. We had a big house, still do. Still live in the same place, and I never minded just being in my room and stuff. It's perfectly fine and healthy for me. Like, I just had a big room. It's like quiet, it's just fine with me. They made sure they even installed like an air conditioning unit for me. So things like, I didn't have to leave, the room and things like that for it to me to be happy.
Right.
And same for my father, who's downstairs. I'm like a new addition to the house, on the inside of the house. So like, it wasn't like I was in conflict with my parents at all. There wasn't any kind of relationship like that. But it was just one of those things that, because of his condition, for his like health and well-being, he needed changes to be made for sure.
Okay.
And then I guess one of those changes was moving me, which they did, and then they instituted other changes, like they bought him some workout equipment. They started doing some other stuff that I noticed immediately when I came by for Christmas, but I haven't been back since, because making contact with them is probably bad, I guess, for my father, probably. So I haven't seen or heard from him since then, I guess.
Okay.
And I guess that's going to continue that way, probably. But I guess that might be typical for people with his condition. So it's just, that's how it is. And my mother, she's not very stable, not very good with anything. My father was always the one who would kind of balance that out, in the sense he has a dementia.
Okay.
It just kind of collapsed everything.
Any siblings?
Yes, my sister, but she got moved out, and I thankfully got married, and she doesn't contact me or speak with me either. I don't really know why, but I just don't think she wants to have anything to do with my mother or father either. It's not like it was easy on her.
Okay.
Or it's not like she wasn't abused either. She was. So, I mean,
she just doesn't keep contact with anybody.
Probably. Or probably to the least she can.
Yeah.
My mother was like constantly contacting her and like been super involved with her wedding and things like that, but I'm assuming at this point she's probably lessening contact, if I had to guess, as much as she can. Which is probably why my mother was getting increasingly like agitated and stuff like that, because she would like call like video chat, iPhone stuff like multiple times a day and things like that. Just because she was excited over like the wedding and things like that. And I think that stressed my sister out, because that's just kind of her personality.
Yeah.
To be stressed with stuff like that, like
overwhelming.
Yeah, to be overwhelmed. Yeah. Her husband isn't that way. He thankfully like could handle all that. He was very like outgoing personality and stuff like that. But she gets overwhelmed. Yeah, she's pretty quiet and things like that. In certain times, she's not like completely quiet and things, but like she's not like him, And but even him, I could see he was getting kind of overwhelmed. So it's like, and I wasn't able to do anything to help, because I couldn't. By the time anything was happening, my father's Alzheimer's and stuff. If I had been when I was in high school and things would have been different, but it just wasn't. Because I used to kind of be the sibling that would, like handle those kinds of things for her and stuff like that. And I just couldn't do that anymore because of my father's condition. He just doesn't act the same, and you know what I mean. Like his agitation could turn into violence and things like that. And my mother used to be the violent one, and she drinks and stuff like that, and started to do that more and more as time went on, probably because of my father and things like that. But it used to just not be that way. And we only had to deal with just my mother, but it's not that way
Do you
anymore.
have any other type of support, like friends?
No.
Nothing? Okay. Do you have, like, any type of therapy or counseling?
I did, but I don't anymore. I asked about that with Miss Jannelle. Nothing was found or happened, or maybe she couldn't, like, she had to work on other things for me.
Okay.
If you could look into that, that would be appreciated.
Yeah,
but I knew that my behavioral health options were limited because of me being in physical contact, potentially with, dangerous people who could be at behavioral health type clinics. So you'd have to find me, like, almost a private practice psychologist or someone like that, which I know is a lot to ask. I had one of those before, but then Aetna stopped covering them because it was expensive.
Right.
But having, like, a one-on-one at their physical building and practice, I've kind of appreciated that. I'd like to do that again, but that's basically the requirement.
So what's the reason for not being able to do?
Because the other behavioral health facilities were behavioral health or mental illness, and that was the typical coverage or, like, available ones for Medicaid. And even eventually got to the point where if they had too many patients, it just in general, they didn't want anyone in the waiting room with me because of how dangerous it could be. Because they'd have a schizophrenic or something, and then they'd look away, and then I'd be dead. And that's just how it is. I didn't necessarily feel like anyone was gonna hurt me, but I understand and trust their word on that those individuals can and do act that way, especially when things would happen, like the nurse would have to come out or would come out and then start saying something like they probably shouldn't have, like maybe a different nurse, not under my position, like that they're basically just all of a sudden not going to see that patient for some reason, even though they cover the patient and things like that, and that patient all of a sudden feeling frustrated and agitated, and that nurse didn't see that I was sitting there. And they probably wouldn't have done that if I was sitting there. They probably would have waited, because now that patient was, just dropped off. They don't have their transportation anymore. The transportation left. So the patient who has no way to leave, and this patient is known as, weak and frail, and they're a cancer patient, and this other patient is now in, like, state of crisis or something. And so that happened enough times that I no longer could basically physically go to my psychiatrist, really. And they kind of shut down their operations in terms of those types of things completely, because they had, I think, too many problems with that.
Where were you going?
I was with Dr. Weiss at the Epic clinic for she's the head of Tulane's psychiatry, actually. She's a good psychiatrist. I wasn't.
Right now you don't have any psychiatrist that you're seeing?
No. She said I didn't need any.
Okay, that's completely okay.
The only thing it would be counseling, for me to speak to someone.
Okay.
If you guys could find me something that would fit those kind of criteria, and they would just, I would appreciate that. So that's something to work on. What?
So are you taking any type of behavioral health medication?
No, I'm not allowed to. I have epilepsy.
Okay.
So I'm not. I could die. They would start having seizures until I couldn't breathe.
So you started having epilepsy with the medication, with the treatment that you were having, the Intron? Okay.
But I've always probably had epilepsy, underlying. I was just born that way. But they found it because of the Intron.
Okay.
I started having tonic-clonic seizures in June, through probably sometime in July, through September or so, or October maybe, for the subcutaneous injections of the Intron. and then they pulled me off the Intron, because it was basically wait until you could go as far as you could with it. They knew that I would have brain damage from it. It was always going to happen. You signed on for that. And seizures were a way to judge how bad it was getting.
Okay.
And I was one of the better patients overall for like outcomes.
Okay.
Okay, let me.
So the.
It's too loud for me right now. Sorry.
And that was 2008, correct?
Yes, ma'am.
When was the last time you had a seizure?
Like 2 days ago or so. I don't know.
So you still.
Yes, ma'am. I do. I have medication that prevents me from having the seizures, but if I just like don't have the medication in me at a certain point, or sleep too long one day, or something like that,
Okay.
I can get. Actually, I need to go take my medication out. I had it all out like this. I also still need assistance with finding vision, ophthalmology,
Okay.
because I need that for cancer screening and glasses that I still probably need a new pair for. I think my vision changed and I haven't been seeing as well.
Okay.
Wait, did I change? Oh, I did take the phosphoric acid.
Should be superior vision.
Cause I haven't been able to get into anywhere myself, so I'll probably need y'all's help for that, like with finding other places so far, because y'all have been a pretty big help with that. Like y'all found me like I couldn't get into New Dermatology until y'all, I guess, contacted them, but then it worked.
Okay. So you need ophthalmology. You got to try to get counseling involved. You already have waiver services appointment.
Is there anything I should ask for the waiver services specifically?
Let me pull up the.
Like, or what you would suggest for me to talk to them to try to get, or should I just go through the motions with them? Because food services or something Miss Jannelle was talking about. Is that working out?
I did see that she had a note in there about, because she did say I think you get like a small amount of money for food stamps, right? Was it like $67 or something?
63. 63.
Yeah, I mean, because a lot of these things on this list they can help you with, so they probably gonna go over every single portion of it, like personal assistance. They have adult day health care, which you don't need, therapy services, nursing services, home delivered meals. They have all of that with a waiver. So they're gonna come in and go over every single part of that. So like you said, up to 2 meals per day delivered to your home. That can help out.
Oh yeah, if that could be done, that
Yeah.
would help. That would help a lot.
Yeah.
Just because like today I'm asleep and stuff, and having those meals just delivered,
Right.
that
And
would
even
be a
with you,
big
you know,
deal.
having narcolepsy and things like that. And I mean, your house looks good. You know, you can tell you know, I'm a clean person and everything like that. But even
That takes a lot out of me.
yeah, that's what I'm saying. Like, you know, you have a
I,
lot going on,
if
so they
I,
can come in and help with that. You know,
yeah,
they
that
can
was just
organize
handled.
anything. You know, and I think every
That would
little
be
bit
a
will
big
help with
help.
you.
Because I used to be a lot more like dysfunctional and stuff in
Yeah,
high
yeah.
school because
Because you can conserve your energy to do, you know, other
exactly,
things.
because
So
my mother would handle basically well. She didn't handle the cooking and stuff. She kind of stopped. We didn't really. Their behavior and stuff wasn't good. But I had money from my parents and I
mhm,
could get food, you know,
mhm,
and I in school made sure I had food.
right,
It was really school.
right.
School was the reason, like in high school and college, because of the school. If I didn't have that, like the lunch and stuff, I
Yeah.
wouldn't have had food to eat.
So,
But that I had food and that was good, sufficient, you know,
mhm.
I was I was a lot healthier.
Yeah.
And not having that has been that was always kind of going to be a problem.
Mhm.
And like it just started to look worse and worse over the years because
Mhm.
you know I had those years of having it and
Mhm.
it built up and then 4 or 5 years if not, and then you know you get to current day and
Yeah.
that's why.
Yes, I think they'll be a great help for you.
Food stamps have helped a lot, but you know, I've only been on that for a year.
Mhm.
It took a very long time to get that. I had to have a social worker who was also a judge get me that
Really?
at University Medical Center. Yeah, it took her. Um, Being able to do it herself. Before that, I just couldn't get it. It was just, it was, I don't know, it was a problem. My
Mhm.
family has a lot of money,
Yeah. Okay.
and she had to be the one to like evaluate me, and by that point, it was like I didn't understand like what was probably going on. I wasn't aware of my own circumstances. That's how like bad things had been, like
Mhm.
how much I was lacking in nutrition.
Mhm.
I wasn't even gonna be aware enough to like ask to try to work on my own health care in certain parts. Like things were just had evolved to be really, really, really bad with my family.
Mhm.
So they had gotten so much that it was already past the point for me because I still have cancer, so
Mhm.
I can't just like fall off a cliff and
Right.
then something has to be there for me to be built back up. But
Right.
then if I do, then it's fine. Like I was, things have been different probably with my family and especially with medication. I still would be in the military like I was
So
in
you were in
high
the
school and
military.
college. Yeah, I was in ROTC and everything. So, that was it, for medical reasons, especially. That was my career options. Was that for engineering, and but the big prohibiting factor for that was changes in issues with medication.
Mhm.
But that was the same for everybody. It wasn't
Mhm.
just me.
Right. Right.
It was everybody, but it was especially a big deal to me.
Mhm.
And in the military's focus for the Air Force and the Navy was making sure that I had continued access to chemotherapy and follow up for cancer, and they were very on top of that constantly. I was very involved with policy changes, additions, every step of the way because I was the oldest living patient with melanoma for children, and I still am. I'm the oldest one on record, and
Wow.
so I still am pretty much the one who's the go-to for all of that. It was a very big deal around then because they would have people showing up to school to ask me questions just because they couldn't get for sure on what really was going on with me, and if they could figure that out, then they could turn around or pick up a phone and then figure out what was going to be needed to be voted on or something. And it just ended up working out that it didn't work out like how I would have liked, even though they were able to get me to university. There just wasn't any safety net there, and there wasn't for any other student either. The year I was going and entering LSU was the first year they had a health plan for students, and they still didn't have the age expansion for students back then either. They had just, the year later, they had to emergency push it to 23, but because they figured out that people like me had no insurance all of a sudden, even though I did because my father paid for it privately. But so that was just worked out because of the military mainly. They kind of helped set that up. But the it was something that was just happening kind of in the background constantly, and that was causing issues with my medication, like the Adderall and stuff, which I need to prevent the seizures, because I'm on that, it prevents the seizures. I just took that, and it also treats my narcolepsy, and I have to have it for that reason. I still have constant medication issues with just getting that because of shortages and stuff, and that's only gotten worse probably. Back in high school, that wasn't as much of an issue, but I also didn't realize how prohibitive in high school it was going to be, in just a general, like, working relationship, to have to somehow go to the doctor and get a prescription for the script, and then get it filled. I had always had my mother helping with that, and stuff like that, and the officers I was coordinating with and things like that, they actually kind of were also oblivious to that. They were like, they just, were like, oh, well, his mother's just gonna help him do it, because that's how all the other kids work. Like, their families would just help them get their medication, and it was just so common that they would need ADHD medication and things like that for the kids. They didn't have any issue with it. But so many things just were going on that they needed the kids to be able to get their medication themselves, or some things to really change, and that just didn't work out, so they started to move the children away from service and its connection to medical care. And people like me, then our only option was disability. Which is and so I retired and went on disability.
So you did ROTC in high school and in college. So did you ever go to, like, officer school after, or did you graduate college?
ROTC is officer school. In my context, I was an officer,
Did you graduate college?
I was given an honorary diploma because of my answer. I entered with too many credit hours. I had too many credit hours through the military. I had credit hours from high school. I went to St. Paul's in Covington, and they are a college, technically. So I had just random hours for that. I was also in some federal biomedical programs there too. I had a bunch of hours. So, like, it just, they had stuff on record. And they also didn't want to allow me to enter into university again in the future, and things like that. So that's why they did that, so that I would not, like, have never had, I wasn't allowed to say that I didn't have any college, because that would be completely false. That's like a different thing. Like, there's a lot of grant programs and other things with disabled that you can access if you've got, like, a zero education. But that was not my experience. I went to one of the top schools in the world. I was, like, very, very highly educated before I ever stepped foot on campus and at university for LSU. I was basically a graduate student at LSU. I was treated as a graduate student. I was offered TA positions when I was a freshman. It was a different experience for me. The only issue was healthcare problems, that just, in my healthcare and the research surrounding my cancer is just too important.
Yeah.
To do things like risk being in, environments that I could get killed in because of, pathogens and stuff. And then just a few years later, the COVID.
Yeah.
Like 2 years later or so. So, I mean, I would have had to leave campus instantly at that point, anyway. So it's me just having to go back home and then start the disability stuff and getting on disability, like right before COVID.
Mhm.
It just worked out.
Okay.
All my friends
So
had to leave college
are you not able
too.
to get any type of military, like, disability benefits or anything?
No,
like
because
VA?
I wasn't enlisted,
Gotcha.
so none of the veteran stuff counts. I do see VA doctors, and I can get VA healthcare and stuff like that. I can be seen anywhere the VA does anything.
Okay.
That's always been the case. Most of my doctors for oncology, all of the programs for all of that was all stuff with the United States, or with the Army Surgeon General, things like that. It just kind of depends. Most of them were officers or held rank in some regard. It just, I'm not like excluded from anything
Okay.
that the United States can provide. I just don't get like, disability settlements or anything like that.
Right.
Because all of that surrounds the individual's initial contract, and I didn't sign an initial contract that would have given me any of that.
Okay.
My contracts were signed when I was little.
Gotcha.
For the Navy, and then later on for the Air Force for school. And none of that would have been the typical like enlisted individuals. Like, I'm signing this in my contract might include the GI Bill, or my contract might exclude that because I don't want to go to college, but I want extra health care, I want extra insurance, so that I can give, because I have like, maybe I don't have a wife and I have a daughter or something, and I want to make sure that she gets a few $1 million. I sign on for that. And you can do stuff like that. Like my grandfather, he didn't get the GI Bill, and he signed on for the Air Force, but he signed on back when it was still the Army Air Force. And then but the U.S. Air Force at like the same time, so it was the transitioning over, and he did not sign on for any medical anything, because that was how that was, but they still wanted to give it to him, and they worked with me when I was just in the Air Force in high school to try to work out his VA stuff, because he didn't need to get VA anything because he had insurance and things through the iron workers or whatever union things for construction, and he was a foreman for that.
That was your grandfather?
Yeah, for nuclear reactors and stuff like that, and projects for the United States and things like that. And that was my grandfather on my mother's side, and he just didn't really like wanted to get VA healthcare even, but they wanted him to, because, and they were really, I guess, forceful. They were probably waiting until me before they were going to push it on him, but they like to track all of that. They don't really accept not doing that. But since I wasn't enlisted, since I wasn't working around reactors and things like that like he was, they didn't really have a reason to force that on me, but they do for him, because they want him seen at the VA, and that's where he goes for everything. They don't want me seen at the VA because they don't have the need to track me in that context due to me being exposed to anything on a base or something like that, because I was always too important, so I was always kept away from that. I was on military installations and things like that within program scopes and stuff, but it was always diplomatic or governmental, like high-level leadership things in Washington, D.C. That was our program. It was like the top of the top. I was already at too high of a rank. They were the enlisted students were already
program to be too high of a rank, you were going to be leaving to take positions that would not allow you to like see combat. It would be different. It was a different thing. We were at the top of the top, so it was like filling those kind of slots in usually a professional context and stuff like that, like engineering, medicine, and things like that. So it was just not your normal person needs to go to the VA hospital. But I still, Dr. Bowman is a VA doctor. I mean, I could still, because of my cancer, some things about me are still seen with them, but they still don't want me at the VA inside it too much, just because of other stuff like that. Like they have, I mean, my epilepsy with, they have different like rules and procedures there with like smoking. And exposure to stuff like that, and if I'm around any tobacco things like that, like particles and things like that, I could have a seizure immediately, because that nicotine drops your seizure aggression, and unfortunately, it seems like that has gotten worse with me. It's probably I don't know, I haven't gotten it for sure from anybody, but I think it's those like the vaporizer versions. That's the big change that I saw. Before that, there wasn't that much of an issue. Even with people who smoked, like with secondhand smoke, walking by, it wasn't that much of an issue. But I had times with the vaporizers, because the vaporizer and like I was on a nebulizer for the first few years of my life when I was born, and things like that. So like that's what I kind of equate it to, because I've just been in areas that I didn't expect anything to happen, but like friends would have small amounts of nicotine and things like that in their vaporized Juul things, and I'd be in a room, maybe the room wouldn't have enough ventilation or something, and I just hit the ground.
Really? Wow.
And I was on
the medication.
On medication too.
Wow.
Yeah. Okay. I do have a lot of brain damage, and things like that hadn't been seen a few years ago, but they did suspect that there would be instances that were kind of emerging that I would have huge problems with, and I'm assuming that that's what they were probably looking towards, because they had a lot of officers had issues who had underlying things with epilepsy and stuff like that. In like Afghanistan and Iraq, and that's what they kept talking to me about, was because they were really worried about that, but they hadn't seen those issues with me here stateside. And even though we've kind of been around places, I did have a seizure on an Air Force field trip, and that caused huge problems, and that's when they started like really being like super hovering about it, and but those Juuls and things like that hadn't actually hit the market really for another like year, and then but once I think that kind of started circulating, they started seeing random kids in high schools and college. They also kids in my class and stuff like that, were some people who didn't know they had any issues were just having issues all of a sudden, and so then I couldn't go back to college, I couldn't go back in person. They knew it wasn't going to be safe for me all of a sudden, and by this point I think they're really, really certain that I don't know if students like me could even attend school anymore. I probably couldn't. I doubt I could have gone to high school in the current circumstances. I just got lucky. I'm probably just more disabled than the opportunities I had, like with military service, would have ever permitted normally. It was just kind of like just a pure luck factor.
Gotcha.
Things just worked out.
The way,
But usually someone like me just would have been flat out too disabled to be considered at all.
Gotcha. Do you have a living will or a power of attorney?
I don't think so. If I do, I'm not sure. It just probably doesn't apply.
Okay. So you really don't have anyone to make decisions for you if you're unable to make decisions for yourself?
I make the decisions for myself.
If you're unable to?
No, I don't want anybody making
You don't
any
want it,
decisions
okay.
for me. No. Because my mother will try to, and I don't want
You
that.
don't want, okay.
Yeah, so I want whatever will disallow anyone to do anything, so that I have to be resuscitated and treated.
Okay.
To where I have to be the one that can make decisions, so that I can make that decision.
Okay.
Whatever, if you guys can help me with that, that'd be great. I don't know if that's something I'll do, or if you guys can set me up with someone.
Yeah, they
who
can
do
get
that.
you to get, you know, your life planning set up.
It's called life planning
Mhm.
stuff. Okay, yeah, great. That would be great.
Yep. Get that list for you. Okay, and then what's your current height and weight?
I actually checked yesterday when I was getting on MD Anderson's account portal again.
Mhm.
Apparently they have it as 5'6.5"
Okay.
instead of 5'7.5". So I'm gonna go with what MD Anderson says, and they
Okay.
say I'm 5'6". So
Okay.
yeah.
5'6".
I didn't realize I was 5'6". I thought I was 5'7.5" because they did measurements with lasers.
Mhm.
But I got hit on the head a bunch, and they died a few times, and people did say that some stuff may have moved with my skull and stuff like that.
Okay.
And you know, me being slightly taller was also because I was on growth hormones. So I may have, in lacking that, I wasn't supposed to happen. So I'll see what happens with the hormones now that I'm back on them. But I guess I'm 5'6", yeah.
Okay. And how much do you weigh?
I was 114 pounds last time I was weighed. I probably am more like 110 or something.
Okay. What pharmacy do you use?
Mandeville Pharmacy. It's down the road that you got on to get here.
Mhm.
All the way down. That's right past the Mandeville police station.
Okay. All right. And then I'm gonna just go over your medications. Is it all of them here?
That's the wrong box. This is just the vitamins. Well, there's one prescription in here. Let me go get the right box. Some of these are duplicates. Here's one. This is Adderall. This one's related to that one.
Do you have like reflux issues or?
Yeah, I think a physician, or not physician, a speech pathologist I saw last week, or 2 weeks ago, noticed, I guess, something on the live stream thing with appointment I had with her. And she had mentioned she was going to talk to a doctor to get me a prescription to help with that.
Okay.
And she mentioned something about GERD or something, and my father did have that as a diagnosis, and
GERD?
yeah, or something like that, and fought with that for many, many years, and then they resolved that somehow. So they wanted me on that for some reason. I'm not sure why. It seemed like it might have been a temporary measure or something. I'm not sure. I did have ulcers with the interferon.
Okay.
And I do see gastroenterology, and but they've been pretty successfully treating me with the dicyclomine.
Okay.
I think it's dicyclomine,
You
right?
haven't,
Or whichever the one is for the
Sulfamidine. Both of them.
dicyclomine, yeah, this one. That's great. That's been great.
That works. Okay.
That's been prescribed to chemotherapy patients like me in the last few years or so. After they did trials with it, basically starting whenever I was on treatment initially for the initial infusion. I just wasn't on the trial for that, even though they did have the trials at MD Anderson partially. They didn't include children, but once I became an adult, I guess they kind of started trialing that with me to see how it would work and things like that. And then they started feeling more confident about it, I guess, over the last year or two. And they started putting a higher dosage and things like that. And I can take about as much of it as I feel like. And in concert with anything else too, especially. And it works really, really well. With the chemotherapy damage, it is very, very effective.
The spironolactone, what do they have you on this for? Is it for
hormones?
Okay.
Yeah, that reduces any issues that I would have with testosterone.
Okay.
Because it seems like the testosterone causes problems. Like when I have less of it, I end up being healthier. Like I was when I was younger, before I guess I built it up naturally. And it's probably most of it's probably gone already just because of that, but that keeps it at like a minimum.
Okay. I didn't even know they had an off usage for that. That's new to me.
It's probably only used that way with people like me who were born with basically zero production.
Okay.
On my test results and stuff when I was little for my baseline, I had a scary low like amount, but I guess it was still something. But it wasn't like something you would just get more of. It wouldn't go to some healthy amount. That's like impossible. So I wasn't gonna, cause it was like pituitary gland function and things like that. Like you weren't going to recover from that. You were born that way, and the interferon could have only damaged all of that anyway.
Yeah.
So I was only in a worse position overall. So that probably only works in that way for people like me. I doubt it's used that way for other people.
Yeah, cause I actually take that myself. I take it for acne, cause that's an off usage. It's really a blood pressure medication.
Really? Yeah, I assumed it was a kind of niche thing. I think it's probably for acne as well for me.
Yeah, cause you know, like it's hormone, like you said. I can see that now that you're saying it. It's kind of keeping it at bay, but you know, it does control the hormones from me having acne, because my acne was hormonal. So it kind of makes sense.
My acne was also partially hormonal, but they put me on especially since my circumstances with like not having hormone production and things like that. Accutane was very, very like efficacious for me. It worked really, really well.
That's good.
It didn't work. It worked pretty well with my sister. So it just worked well in my family overall, but it didn't work as well with me. Like with me, it just made like the skin just change permanently. Like I had a really like noticeable success compared to like any of the other kids who were on it around me. And practically my whole class in high school was on it. The class under me, like every single kid, their parents were almost mandatorily putting their kids on it to go to school, because having your kid not have issues with shaving and stuff was a requirement to attend. So the school basically told everybody, like, look, if you can't afford this, we're going to send you to a doctor that might be able to help, because it was very expensive. But like, if your kid has acne at all, we want your kid on this, because it was just that type of school. They care. The school's there to help the student and things like that, and that's just one of the things that they would focus on. It acts as charitable funding or something for the parents, even for medications and stuff for kids on like a case by case basis. that wouldn't have worked for me. I cost too much money, but I had insurance and things like that, and some kids, they weren't really in that circumstance. The Accutane was pretty expensive.
Yeah.
But it was covered fully for me. In the day they could get me on it by age limitation, they forced me on it. They made me in a school so I could go and get a prescription because the government was watching super heavily because they already had cancer related things with it. So any patient with melanoma was pretty much forced by law to be on it, just to reduce the chance of having like basal cell, I think, sarcoma.
Okay.
Because it could almost like eliminate that.
So tell me, like, what is your goal? What do you want to happen right now as far as your health or anything else? So I can put that in your care plan and we can get started on that.
Medically, I don't know. What things he worked with any other patients before that had successful things that they worked towards on their care plan for like transitioning things? Because I feel pretty good on the hormones and stuff right now.
You
but
do? Okay.
I don't know if I'm on too little though. Like, should I ask my doctor to increase things?
You can.
But it's like,
especially if it's working for you.
So should I, or is this
like how long have you been stabilized? Like how long have you been on it and you feel like, okay, this is working?
I've just got on the initial amount, so I'm assuming they're gonna either increase it.
They probably will.
Okay.
When do you go back to your endocrinologist?
Next month?
Okay.
No, wait, November, like the first few days of November. I'm assuming they're waiting for the first 2 months to see how it was working because they gave me 3 months initially.
Okay.
And since it seems to be working pretty well, I'm assuming they're not going to stay on this. They're probably going to increase. I'm assuming, yeah. I don't think they're going to increase the spironolactone. I think that's the highest dosage that I can be on for my weight. And I'm just going to, like, I'm not going to push them if cause I don't want side effects to be negative or something. If that's working for what it's doing at that dosage, great. I'm fine with that. I'm assuming the estradiol is gonna be increased, but I'm not entirely certain. So I was just maybe that. If not that, then I don't. I would like if you guys could help me to get like laser hair removal. I really want that. So that I can stop having epilepsy related cuts all over my face and things like that. I have a lot of scars now and things like that from that, and I've had a lot of issues this year with my epilepsy because of not being able to access epilepsy medication. The valproic acid, I didn't have that for like half the year. My seizures were really, really bad. I wasn't very functional. It was very dangerous. And shaving and things like that, I cut myself constantly every day. And I really need to have the laser hair removal completely. I have the hair removal already on a lot of the other parts of my body because of all of my major surgeries for my melanoma, for my shoulder dislocation. Like, I don't have any hair here or here because of all the work they had to do. I had a full shoulder dislocation. They had to reconstruct my whole shoulder and the ball and the joints and all the ligaments and stuff like that. And they had to take parts from my left arm to my right and stuff like this. So they had to remove the hair from that side. They already had to remove some.
Shoulder surgery?
Yeah, I just dislocated my whole shoulder, and it was dislocated for about 3 months. And
how long was that? Like childhood or?
2018.
Oh, okay.
I was an adult then, but just barely. I didn't know it was dislocated because I can't feel pain in a lot of parts of my body properly due to the severe brain and central nervous system damage. So I didn't know there was a problem until I went for my annual scans for my cancer that I don't do anymore because I had too much radiation, so they're attempting to. They no longer want me to have scans done at the same level of aggressiveness. But thankfully, they did still do the aggressive scans back then. And
so what kind of surveillance are they doing now for your cancer?
a lot more appointments to check up on other stuff, which they weren't doing before because I couldn't do it because of school. They wanted to, but I wanted to go to school, and they were humoring me basically until they could force me to not be humored any longer. Basically, I really wasn't supposed to be going to school. I was supposed to be on disability the whole time. They were letting me kind of lead my own path, but they don't do that anymore. They don't do that for the other kids either.
Do they do any labs for you?
I think we're probably gonna start more of that.
Okay.
Especially because of the hormones and things like that. So they had other ways to like radiologically do labs. Like earlier this year, they did that at the oncology wing of UMC. They hit me with some radiation blast or something they were testing out, and that they were able to test for a bunch of like rare earth minerals and heavy metals and stuff like that for contents in my blood, and it popped up on my scan that they definitely didn't, because they didn't actually like put anything on me. They didn't put the little thing for oxygen contents or anything for monitoring, but they could still see a bunch of other things, and I could feel the radiation because I kind of got stunned, and I was sitting there and I was like staring into space, and they were basically trying to wake me up and see if I was coherent. So I don't know what it was they were using, but they were testing something. They put me in like one specific room, and I was facing kind of a certain direction, so I kind of knew something was happening, but it's probably some type of a thing that's not released yet. So I don't know what it was necessarily, but it was my first experience with it. It definitely stunned me for like, but I might just be more affected by that because of the epilepsy. It's probably not that big of a deal for most cancer patients. So it's probably like some sort of non-invasive, on the spot, elemental type check for using radiology to test blood stuff.
Okay.
Just because it's faster. And it was fast, because before I even got out of the clinic to get my next appointment scheduled, my chart updated and I got an email that I had blood work or something.
Okay.
And I was like, I didn't have any blood work done, but it's already here, and it had all the things for it. And you guys can probably access that on your own.
Yeah.
And to see my oncology appointment for this year, if you go there and you look at my chart or whatever, it should have, through Aetna, the information for that, and I was very impressed by what I saw.
How long have you been on Aetna's insurance?
Since 2017.
Oh, okay.
My mother had like a breakdown, and she went to the coroner's office and perjured herself and lied about being suicidal so that she could like punish me or something. She had never raised it, and they didn't, but that was like,
so this is not new insurance for you. Okay.
And then when I was in the facility that they had me at, because they didn't want me to go home because my mother was like homicidal or something, they were planning for like long care, I guess, or something. So they just immediately like forced me onto Medicaid, and then I got Aetna like that same day or so, because they didn't want to just bill my parents' insurance, but I still had their insurance, and they were gonna pay and stuff like that. But like they weren't trusting everything because that was how bad my mother was for that week or so. Okay. And then earlier this year, my mother did the same thing, but when the sheriff's deputies came by, they knew what was kind of happening and stuff, and they showed up with a lot more. In 2017, they only had one guy come by, and he didn't know what was going on. I wasn't very coherent. I hadn't had any food and things like that. So it was already kind of a bad circumstance, but earlier this year, it was actually Easter. My mother did the same thing, and she had shown up drunk earlier that night with actually like someone else who I'd never met before. So I had let the ADT security system contact law enforcement and things like that, and law enforcement didn't even really realize that they had been contacted because my mother had gone and done the OPC thing earlier that day, I guess, on her own, and I guess she decided to show up drunk afterwards, like, you know, because she just did that, but because it worked out that way, they brought me just to Lakeview, and then I guess explained what happened, and the doctor attending that day, he sent me home immediately. So it was pretty quick compared to like 11 days, which is what happened in 2017.
Alright,
But it was also a different circumstance since I live here on my own, and my mother does not live here, and you can't get locked out because you have a key. But, you know, I do have a security system provider I pay for, so like they could send me home safely.
Oh.
Whereas in 2017 they couldn't send me home safely, even though my father was trying to convince them that he would be at home and he would be handling stuff, like he was like, I'll handle stuff with like Linda and stuff like that, and that's my mother, and so like he was talking to them and trying to convince them, but they didn't both, it wasn't safe. I don't think he knew that either. I didn't understand that either. It was just different back then. We would have been in too much conflict. It would have been too dangerous. Even though my life was in danger at that facility, I guess that's just how they handle things procedurally. It was bad. I had a lot of trauma from that, but I worked through that whole thing, and I getting on Aetna right after that helped a lot, having my own insurance. And that's since I've been with you guys since then.
Okay. Sounds like, I mean, I know Aetna is not like private insurance, but they work pretty good.
It's the same to me.
Okay.
Mainly because I'm kind of special. So the United States has always worked my private insurance like it's a special plan because they had to assign me a special plan. My father's firm actually purchased a plan just for me, separate from my parents, with Blue Cross Blue Shield. And I had a lot of experience working with them doing stuff, and I did the same stuff with them that I do with you guys. I probably have less stuff to do with you guys than I kind of did with them, simply because, or would have to do with them, because it was private, you had to do so much paperwork yourself. My father could handle that, but like if I still had to do private insurance or something and he still had to help me with that, and he has dementia and stuff like that, that would just be impossible. You guys do all of that on your own. Medicaid just does everything. And I also didn't have transportation or anything like that. So, to me, private insurance had probably less stuff, especially mainly because of administrative things. Like I can call like case management and stuff like that, and you guys can kind of help me out doing stuff. Sometimes you can't, but like private insurance I felt like less of an ability to do that with me for the stuff that I would have needed. My father was able to just pull a lot more strings on his own and do things because he was a lawyer and had a lot of connections and things with his firm. He worked for a pretty powerful and extremely large defense firm, so I could basically, on private insurance with them, just go to any state.
Right.
But it was only just because of them, and being how big they were, and having lawyers in every state, and working so closely with the United States and stuff like that. I was just very rare. I know most people weren't that way. But with Medicaid, it feels like I can do that irregardless, just because it's the United States' stuff. Even if I can't see every single doctor, I'm important enough that you guys seem like you make new contracts for doctors, so I really have to see them. It just is, you know, a matter of time.
Yeah.
So thankfully I haven't had any serious issues with oncology that were really going to be the thing private insurance helped with, which was getting in fast enough to not die.
Right.
With oncology related surgeries and stuff like that. I spoke with you yesterday about the MD Anderson thing because I was kind of concerned about that. I don't know if that's changed at all in the last day to try to work on that, but I did kind of want to set up the ability to just have my insurance taken by MD Anderson. My insurance was taken by Ochsner Rush. I contacted them like when I saw them earlier this year on an emergency basis for neurology. So I would just like to no longer have those kind of emergencies happening because I was way too stressful. That was too hard on me physically. I don't want to have to deal with that with cancer too, just in case.
Yeah, I've had patients in the past, not with Aetna, was with Healthy Blue, that tried to get to MD Anderson. MD Anderson usually will take them on a case by case basis, but you already established there, so it's different.
They're my main thing.
Yeah,
like I'm a research patient.
Right. So it should be maybe something that they can do.
I'm kind of a very important patient to them, just because
yeah.
of me being able to just live.
So since you already
and
there,
because
yeah.
they won a Nobel Prize due to my treatment, and they kind of like I feel like it's a really easy thing to convince them. They're gonna be really.
Yeah.
I just think that they.
Especially since you're known to them and.
They probably already think I have Medicaid, having everything already set up, and I don't know how to like tell that to them because it's probably something I have to initiate on my own. I don't know how to do that.
Yeah, I'm gonna talk with utilization about that because normally they will say, hey, we don't take out of state Medicaid, but since you're already established there, and have you seen them under your Medicaid ever, or was it always under your dad's? Okay. Yeah, so they typically say we don't take.
I saw them at the same time I had y'all, and I informed them about having y'all, but they acted like it wasn't a big deal because they work as though they're still the VA pretty much at the same time, because that's also what they are, and they basically were like blankly staring at us like, yeah, sure, he's always had Medicaid, because I always did, but like it was always in the background, you know?
It was like secondary.
And so like, yeah, now they give you a card for it, great. And they just kind of like moved on.
Okay.
But
yeah, I'll check.
Now that it's primary, you know.
Yeah, I'll check with utilization for that, and then we'll work on ophthalmology, counseling, and then waiver will be in next week. It usually doesn't take them that long to make a decision after you've already got the appointment.
And then they'll start probably with food and things like that.
Right, yeah. So that'll be a big help, and hopefully you can get some worker in here if you want, and they can help with like cooking and, you know.
I do. I'm kind of apprehensive about that just because I'm worried about stuff.
Yeah.
Like things getting stolen or things getting
right.
moved. But I also know that that's just that level of anxiety is related only to like my family.
Right.
And has no bearing on anybody else. It's never once been a problem with other people. It's just
no, I completely understand.
Just been
your
my
home
family.
is your safety net,
and
so having other people in there, yeah, I get that.
That's just something I need to work through and get over. So I'm fine with someone being in here and doing stuff. I'll be fine with it.
Okay. Well, it was nice meeting you. I'm gonna work on all of this for you and get all this printed, and I'm gonna look for some different resources that can be available to you. I'm gonna call Jannelle and see what she came up with, because I wasn't able to speak with her before our appointment, and then just get you all the resources that we can with under your Aetna benefits. Okay.
Yes, ma'am.
And then do you use certain pronouns?
You can call me whatever you want.
What
They said this at the specialty clinic for gender stuff. They encourage like using things like ahead of time, so they did the she/her thing.
Okay.
But I don't actually care. I'm fine with. I don't mind being called he. I don't mind being called a she.
I feel like a different name.
No.
Okay.
I just say use my name or use anything really. It's
Okay.
just I don't use any like alternate stuff.
Okay,
It's
okay.
just I kind of feel like with my generation, since I also have a lot of friends like kind of like me and stuff.
Mhm.
It's using either or is normal kind of a thing. We don't really like stress about that
Okay.
kind of a thing, and it's more of like if it's easier for like whatever's easiest for the healthcare provider to do is what I prefer. Like if they don't want to like catch themselves or have to second guess like what they're gonna call me because of my appearance, I'd much rather that. So it's whatever you guys want to mark down that makes it easier for y'all.
All right. It was nice meeting you. I enjoyed talking to you. Very intelligent.
Thank you.
Yeah, you have a good day, okay? And I'll get back in touch with you after I speak with Jannelle, okay?
Yes, ma'am.
All right.
Oh, I locked it. That
Okay. Thank you so much.
Thank you.
You have a good one.